the state moves from pandemic shutdown to new stages of reopening, there will have to be changes in transportation on the MBTA that will have to mean providing more service without putting riders and employees at risk of infection. With some advice on how that should be done, there are two advocates, the executive director of the Livable Streets Alliance, Stacy Thompson, and the director of Transit Matters, Jared Johnson. Thank you both very much for being with us.
Thank you for having us.
Thank you.
I want to start with Jared, since you've got that orange line background there. The T says it has a plan for reopening, in terms of service levels, in terms of hygiene on the vehicles and the stations. But what else do you think they need to do?
The good thing is that, even though we're talking about sort of reopening the T, the good thing is that the T never stopped. And so, they did, of course, there were in the beginning days, there were, trying to figure out, how to adjust to this new normal. But it really is just continuing what they've been doing and stepping up on that. So, they've been stepping up their cleaning regimen on the trains. And so now it's just, the opportunity to keep on doing that and to look at, new things like putting in hand sanitizers at the station, making sure that it's very visible that the cleaning is happening. And of course, increasing service. I think that's one of the biggest things that needs to happen, even if the ridership is not, at the normal levels. Getting closer to a normal schedule will allow folks to be able to do physical distancing in the trains. And that's really the most important, probably the most important thing that the T can do.
Stacy, even when the plans are good, there will always be these deviations. There will be spikes in crowding. There could be a downpour and people rush into the T. So how do you get the word out about that? How do you allow for flexibility around that if people have to wait for the next train?
Yeah, that's a great question. And our message to the T has really been, what you've been doing the last few months is great and keep it up. I think what's hidden or behind the scenes is that for many, many years, for decades, the T would set a schedule and then stick to that schedule for months, unless there, was a train broke down or something like that we've all experienced. But when COVID hit, the T focused on a new level of flexibility. And what that meant is they, reduced service, but then said, hey, we got a report that there are too many people on the 28 on Blue Hill Ave. We're going to add a bus to that line. And that level of sort of responding in the moment and looking for patterns is new, and it's really good. The T has, in fact, updated the way that they schedule bus operators so that roughly 30% of the folks who show up at work every single day are flexible, meaning that they can respond in the moment and they can go to a different route that might need support, sort of deal with the changing universe. So we would say that's really great. And that shouldn't be just for COVID response, that should be for always. Separately, I know about this and Jared knows about this, but the public doesn't necessarily know about it. So what we would love to see the T do a little bit more of is communicate more directly with their apps. They've already started doing some real-time updating in the app so that that there are scheduled changes, but then to also put some information actually physically on the bus or the train. Where we normally see ads, the T could communicate, hey, this is where you get more real-time information. This is how you find out what's going on. So, we love the work that they're doing, but we want to encourage the MBTA to better communicate with the public about the great changes they've made over the last few months.
Jared, you've also been thinking about scheduling in a very fundamental way because, all my life on the T, I've been used to peak hour crowding and traffic. And you're saying that maybe we ought to rethink that. What would that mean?
Yeah, I think it means looking at the data. I mean, one of the things that was really interesting, and the T's been great about being transparent with the ridership numbers, is you saw the peak shift. The peak is now an hour and a half to 2 hours earlier and is longer. And even though the overall numbers are lower, the difference between the peak of the peak and that midday ridership is a lot less. And so I think what that means to me is that we should be looking at how do we reallocate resources so that we have, so that we don't have such a severe drop in frequency in the middle of the day. And I think that lines up with, that was already the trend with so many folks working in service industry, and then with folks working in firms like tech, where they have flexible hours, and then medical shifts, are don't always align with the office shifts. And so, I think that's the way forward. And especially as we start to think about, in later phases of reopening, as more folks start to come to the office, they're going to be doing staggered shifts. And again, I think this is something that, it's really hard to predict the future, but I think, having flex schedule and not having everyone arrive at the office at the exact same time, I think that's going to be one of the things that sticks around even after COVID is gone. And so, that it just makes sense to us to have, to think about peak differently.
Stacy, peak used to mean no bikes allowed, but you want that to change. Why?
Yeah, this is one of those small but significant changes. So the T used to say during peak hours, you couldn't bring your bike onto the train because there just wasn't enough space. But we are actually trying to create a situation where there is enough space. And the reality is that there are, as Jared said earlier, the T never stopped. And there are a tremendous number of people still relying on the T. Thousands and thousands of people are taking the commuter rail to get to the Longwood Medical area, to get to their essential jobs and services, to get around. And one of the simplest ways you can make the T a little more accessible for folks is to deal with first and last mile connections, meaning it's a 20-minute walk if you're walking a mile to a train stop. It's a 5-minute bike ride. And so on either end of the system, there might be barriers, and simply being able to take a bike from your home and take it with you on the train, one, can actually create some space for you in this moment when we're seeking space. And two, it can really help with some of those barriers. And it's especially helpful in this moment when people really need to get where, if they're getting on the train, it's because they need to get on the train. So let's make that as accessible as possible.
Jared, I want to come to the question of equity, especially around fares, because I remember back in the 90s, people who said that if the state was subsidizing the T, riders were practically on welfare. I think we've come a long way from that, but why is it more important for everybody to move, at least in the direction of free access to the T?
Yeah, one of the things that was really striking about an MIT study that was done last year, and they had control group and a group that got a T pass at half price. And what they found was that is that people were going to doctors' offices and job interviews. And that's not to say that low-income folks don't deserve to be able to go to cultural activities or to be able to have fun. But what it was saying was that people were forgoing really important things and things that would actually get them, that would actually increase their income and actually decrease the amount of money that the state, has to put into welfare. And so, it's really about opportunity. And you look at there's study after study that show that access to high quality transportation is actually one of the most important, if not the most important factor in the success and in helping someone, lifting folks out of poverty. And so, absolutely, this is the right moment to really, raise up that, equitable access to transportation is, extremely important.
Stacy, I imagine it's also important to streamline fare collection, which also makes it less burdensome and improves services. So why is that so important?
Yeah, to build on Jared's point, I think what's really important is that we start thinking about the T as a true public service, just like education, just like healthcare, in that regardless of if someone pays a few pennies to get on the system must run for our economy and our state to run. And that depending on fares, particularly depending on the dollars and cents of our poorest and most vulnerable people, doesn't actually serve the system well. It makes it quite vulnerable. So I think that's one piece, is that spending too much time trying to figure out all the different ways we can collect money from people who are using the system makes the system vulnerable in and of itself. But then separately, what we've seen is that in a crisis, we've immediately sort of taken away that need to collect money at the front of the bus in an effort just to get folks on the bus. So to keep drivers safe, people have been getting on the back door of the bus for several months now. And what we know based on the T-zone studies is that when they have protective shields up for the drivers, they will be able to safely open both doors, and that they could reduce the dwell time, or the time a bus sits at a stop, by 25%. Meaning people can get on and off the system more quickly. They could potentially run even more buses on crowded routes like the 28 or the 111. So there are real service benefits. And we would say in this moment, service is paramount to collecting dollars and cents. Service is what has kept the state going, and we need to prioritize that now and in the future.
Sure, and I want to ask you about one transportation decision that's coming up later this year. It looks more likely now as if the state is going to at least keep part of the viaduct for the Mass Turnpike at the Alston interchange. I can see how that's less desirable for people living in the neighborhoods, especially in the aesthetic sense. But as far as transportation, what are you most worried about here?
What I'm really worried about is the idea that the Worcester line is not going to be active at all times, and that the state is not really looking at the broader picture of, sure, at this, at this moment, or we're probably not actually at this moment because of how far traffic has dropped because of COVID, but, before COVID, yes, you saw pictures of the Pike, at complete gridlock, and that may have made sense to try to do that, but it's not thinking about what is the future of transportation? What is the future of mobility more broadly? Going back to earlier about COVID predictions, no one knows what the future is, but it is likely that significantly more numbers of folks will work from home, at least part of the time. And so, locking in that many lanes of traffic when we know the impact that has on air quality, and on even in the effects of that for healthcare, for children and their education, to me just seems really silly and flies in the face of the state's climate change goals, of the governor's own transportation future transportation commission. And so we're really worried that the Worcester line and that commuter rail is not being prioritized at the time that we should really be expanding that as an option. And we're worried about just spending billions and billions of precious taxpayer dollars for something that really will be very outdated. I think will be very outdated soon as we think about moving away from carving up our cities for highways.